So, a very good afternoon to everyone watching us live from across the globe and from the country as well. We welcome you everyone to the webinar on Pharmaceutical Care Everywhere, organized by Association of Pharmaceutical Research in association with BioLix and Technovarid. So, without much delay, I would like to introduce our speaker for the afternoon, Dr. Naik Nagappa sir, who is the director of Amity Institute of Pharmacy, Amity University of Madhya Pradesh, Gwalior, India. Sir, we welcome you to the webinar. And I would like you to greet the audience and start your presentation. Over to you, sir.
Good afternoon. Very nice to meet you all. Actually, this is a very distinct topic, very pertinent topic, and every one of us will need pharmaceutical care. Then what is the pharmaceutical care? How we have to deliver it? Why it is not popular in India? Why it is popular in other developed and developing countries? I had an opportunity to visit 22 countries and observe how the pharmaceutical care is being implemented. Government of India also brought down a legislation under the Pharmacy Act, that Pharmacy Practice Guidelines 2015 in January 15th. Already we have lapsed 5 years, but nothing much has happened, because it should be for the people, by the people, which doesn't happen in our country. So we all know drugs from A to Z, aspirin to zidovudine, all are harmful drugs, and they carry a bigger risk on our health. May not be immediately, but over a due period of time. See, allopathic medicines, the modern medicine system, has a way in which it wants to ensure the patient safety, which is also very much not reliable or not 100% sure. So they list all the adverse drug reactions. They count on the adverse drug reactions. So for that thing, they have a pharmacovigilance program, and the treatment of the adverse drug reactions, the major treatment is stop the drug, be away from the drug which is causing harm to you. There are no further insight available for anyone to look into the matter and resolve the issue. So in country like ours, where we have a large number of patients and large number of suffering from all variety kinds of diseases, have been administered every drug on this earth. Ayurveda, allopathy, whatnot, homeopathy, Unani, Siddha. So ours is a very complex system of healthcare. So wherein we do a lot of activities on this thing. But due to the pertinent problem of the modern drugs, which claim that it has got a scientific basis, and it is based on the various types of clinical trials and all those things we say. But even then, nobody is sure how the drug is going to react, because every person is a different person genetically, and his response will be different. That cannot be. These are all the things which are revealed due to advances in genetic genome technology. Now people are realizing that there is another concept called as individualized drug therapy, wherein we study a population, how much response a drug has. For example, you take the drug metformin. If I give it to 100 people, the responses may not be same. Some 30% of the people respond in a different manner, 60% in another manner, and 70% in another. What are we making? So we are making unit dosage forms, and we are telling that one cap fits all. One cap fits all, is it true? And many people unknowingly they are suffering, their kidneys getting damaged, their heart getting damaged, the brain getting damaged. So many things are happening. And these effects happen very silently and does not have the dramatic presentation. That's why we continue to ignore them as if such thing has not happened and will not happen to me also. Is it so true? If I look into into my experience, I found that there are a variation in the same dose, same drug by different people at different times. So that's why the modern drugs, although they produce a quick effect and give us the relief, and also they do one more problem. That is, they are going to cause side effects or the adverse drug reactions, and this is a very big business opportunity for the companies. They will make a lot of money out of this. They have got it is also the concern for the human well-being that there is a profession called as pharmacy, which always comes in rescue of the patients using the medicines. So as we know that the healthcare professions are core, three main healthcare professions are the prescribing the medicines and administering the medicines and taking all care about medicines. I am referring to physicians who diagnose and prescribe medicines to a patient, and also there are other profession called as nursing profession who will administer the patient and comfort them during their hard times. The pharmacist is from the beginning of the concept of drug to the concept of to the concept till the drug is administered to a patient, all the responsibilities are taken care by the pharmacist. Although there are divisions are there, that is a different matter. But pharmacy means they have to take care all the matters related to drugs. So this is how the pharmacy profession has been coming up and has come up in a big manner in the developed countries. They have got a high quality of services by the pharmacist delivered to the public, delivered to the doctor, delivered to the nurse. So you may wonder what service a pharmacist can do to a doctor, what service can do a pharmacist to a nurse and other healthcare professionals. As the pharmacist being the expert in the matters of the drug, they have their own professional knowledge and skills by which they help the doctor. For example, you may be heard of an industry called as medical transcription. Why that industry is thriving in our country? The business comes from US and a lot of money, foreign exchange earned through providing the medical transcription. Now, what is that medical transcription? Why it is important? In the developed countries, they have very strict control of the treatments given, and documentation is to be done. And if anything goes wrong, the person who is responsible for that mistake will be identified and punished in the court of law. So it is 24/7. The doctors have to be alert, and in that way they cannot focus on their own job. So that's why they rely on the other professions, like they rely for the patient care nursing. Pharmacists are relied on the pharmaceutical practice or pharmacy practice. So the patients are given a prescription, and before writing a prescription, doctor ideally has to consult a clinical pharmacist who has the thorough knowledge and also updated equipments to test that whether the prescription does not lead to any harm to the patient. So that is a system there, and it is followed meticulously, and that's why the pharmacists are very important for the doctors and for the nurses, of course, for the patients. So patients, the conventional way, approach the pharmacist and ask about which doctor is best for him, and with experience and with exposure, the pharmacist will be able to suggest to which doctor the patient should see. After seeing the doctor, he prescribes the medicines, and that medicine prescriptions are referred back to pharmacy. In the pharmacy, the pharmacist again checks the prescription, whether there is anything wrong in the prescription or any omission is done, any harm can be caused to the patient. He will identify, he'll check the doses, and so many other things he will do. And then if he finds everything all right, then he can dispense the medicine. Otherwise, if he finds any discrepancy, immediately he should refer to the prescriber, ask his clarification, and still he persists, then he can dispense the medicine. So this is the passive act, but again very important act. Further, a pharmacist is patient educator also. So many times actually before going into detail, I would like to state that the services of the pharmacist are broadly classified into clinical pharmacists, who work step by step with the doctors and nurses in the hospital to attend the patient care needs. Then you may say that why doctor has to depend on this pharmacist? He knows everything, but this is not correct. Information about drugs has grown into voluminous, and there are systems like evidence-based medicine, there are systems like meta-analysis, and there are also network meta-analysis. All these advanced systems are beneficial for the patient. So these should be put into practice. Means it is a teamwork. Doctor alone cannot do everything. So a team is built along with the pharmacist, nurse, and physiotherapist and whatnot. So all the team main aim is to provide relief and cure for the patient. So this is how the practice of medicine is followed in the developed countries. Again, we are in the developing countries, we are catching up with the updated method, and several times we feel disgusted that we cannot have such facilities for our patients in the country. So looking at this complexity of the medicines, the government of India, it is not the government of India, it is before only the world learned bodies, they have recognized the role of pharmacists and put their proper designation and place in order to provide the services. Somehow all these systems are remained undeveloped in a developing economy like ours. As a result of it, our people suffer without optimized pharmaceutical care services. So wherever you are going to use a drug, you need a pharmacist and a care by the pharmacist to check whether the drug is appropriate, whether the doses are proper, whether the patient learns about what for the drug is used, and also tells about and educates the patient about how best the medicine can be utilized, minimizing the side effects, maximizing the good effects of the drug in a patient. So can I have my first slide, please?
Yes, sir. I'll just put it
Okay.
on.
So
can you click on next and see whether you can access it or not?
Next, where it is?
Yeah. It is on the below the slides.
Below the
slides. Below the slides, sir.
Video.
There is an option next. Yeah.
I think share आ गया. I don't know. So I'm not able to see that.
Sir, below the slide. Below the slide, sir. There is
below
a next
the
option.
slide. There are settings is there.
Below the slides. No, sir. In no settings. Sir, you are able
I
to
am
see the
able to
slide?
see the slide very clearly, and to the right hand
Completely
corner,
below
my
the slide.
photo is there, my video is there.
Yes, sir. Completely below the slide. See, there is an option written next.
Oh, so as it is a, a small phone, I'm not able to get that slide. Can you please change the slide?
Yes, sir. You can once you're done streaming with the slide, sir. You
No,
can tell me
I'm
next.
ready. You can change the slide. You
Sir,
can
you
go to
can
the next
just tell
slide.
me. You can just tell me next, and I can just.
Next.
Yes, sir. Change on.
So to make you aware of the dangers faced by a patient in the treatment are some of the examples I have quoted. That is, the common man has many problems and doubts while using medicines at home or in hospital. There are many doubts followed while using medicines. Information about how to use the drugs and how to make them the best for our health is a very challenging question for a patient. Next. So there is a Avendia lawsuit information. The US FDA, which is considered as the benchmark of the drug administration, has come out with this thing, safety issue related to Avendia rosiglitazone, a drug approved for treatment of type 2 diabetes. Safety data from controlled clinical trials have indicated the risk of heart attack in patients taking Avendia. Avendia was manufactured by GlaxoSmithKline. So any drug can be problematic to any kind of issues. So we must be very careful. Next. So even you cannot expect that the not only the drugs, some of the diagnostics also can cause very heavy problem in the patients, like the MRI procedure using contrast dye can cause a big problem. So the MRI or MRA uses the gadolinium-based contrast agent. Next slide, please. So that is very harmful to kidneys, and that's how we must be very careful. When we may ignore that, it is a diagnostic test, it will not harm us. It's not like that. We must take care of that also. So pharmacists play a vital role in improving the patient care through the medicine and information they provide to the patient, which we don't see in our system. Pharmacists are just acting like tradesmen, like grocery shop. They are giving the medicine without taking care of the patients. What happens to them? Pharmacy is an exciting blend of science, healthcare, direct patient contact, and computer technology and business. So new things are also getting added. Now pharmacists are involved in giving vaccination to the patients in USA and all. So it was found that when a pharmacist gives a vaccination, adult vaccination especially, it is much cheaper than when it is administered by a doctor. So now they have got a small 3 days training program in which a qualified pharmacist learns how to give vaccine, and he comes into the provide the vaccinations at a cheaper rate for the patients, and also it is good for the insurance companies. Next. So as I have been singing a song on pharmacist, it is not a false, it is true also. I am also being a pharmacist. So pharmacists are consistently ranked as one of the most highly trusted professionals in the USA and in Europe and in all developed countries. There is an unprecedented demand for the pharmacist services. Next. So pharmacy is the third largest health profession in the USA. It is a bit old, but recently also it is coming under the one of the fifth. Pharmacists play a vital role in improving patient care through the medicine and information they provide to the patients. Next. So now we have the variety of pharmacists giving services at different settings. If the pharmacist works in a community, like in a medical shop, here they are called as community pharmacists. And if they work with the doctor in the hospital, they are called as hospital pharmacists. Also, there's another opportunity which has emerged now, and it is been very much popular, called as clinical pharmacist, where they go hand in hand with the pharmacist, with the healthcare system, and update the doctor about the thing. They also go all around along with the physicians, nurses, and they observe many things, and with their skills they identify the probable danger to the patient while in treatment. So that is the very good this thing. They check the doses, they check the adverse drug reactions, they check the all aspects of the patients, and also they are one of the very vital professionals in our country. In India, we are yet to introduce. We have already started a program called as PharmD, Doctor of Pharmacy. It is a 6 years program after 10+2, and this program makes the pharmacist as a clinical pharmacist, which he will be able to provide services to in the corporate hospitals and in the teaching hospitals. Next. So community, please go to the previous slide. There's something I missed the previous slide. So community pharmacist, which I'm very much fascinated, or I'm very much keen to establish its role in the country, are charged with a safe and efficient distribution of prescription medicines, advising patients on a proper use of their prescription and non-prescription medications use, and keeping the records of the patients and their health, illness and medications. So this is the role an ideal medical shop should do, but we don't find any of these things except by trading of the medicines. So this has eroded the confidence of the public in the pharmacist, in the community pharmacist. So they have to manage their own with the help of their limited resources. So it is a very difficult situation for the patients in our country, whereas in other countries they have been given the proper care and attention. Next slide, please. So this has led to the identity crisis of the pharmacist in the India and in other developing economies. Whereas community pharmacists in USA are the most visible branch of practitioners, and there are approximately 50,000 community pharmacists practicing in the country. In Karnataka also, we match that number, 48,000 registered pharmacists who are invisible to the government, health policymakers, doctors, pharmaceutical industry, and to the patients themselves. So there's a big identity crisis because these people won't associate, won't provide any service required by the patient community, whereas in the countries like developed economy, they are very much keen on serving the public. So there they have got a very high prestige. In India, they are not really respected due to they don't provide any services. Next. So same thing. There's nothing new thing I have already told. Next slide, please. So no matter, the pharmaceutical care should be everywhere. This is the theme of the seminar today, because every person, let it be young child or a geriatric patient or anyone, should and must learn from the learned pharmacist and use the medicines in an intelligent manner so that they won't get affected. Yes, next slide, please. So now I don't want to emphasize on this, already spoken. Next slide, please. Can I have the next slide, please? No point in talking the role of pharmacist in India, not relevant. We have already spoken enough. Please, next slide, please. So next slide, please. Sorry, I'm skipping most of the slides there because this slide I want to speak a bit about it. An ideal pharmacist, as described by the Federation of International Pharmacy, they say that he is a caregiver, he is a decision maker, communicator, manager, lifelong learner, a teacher, a leader, and a researcher. So if a pharmacist does all these functions, then he can be accorded as a 7-star pharmacist. Next slide, please. So mostly the public approach pharmacy for symptomatic relief in order to avoid a doctor, because immediately they don't want to meet a doctor and get a treatment started by the doctor, because the one is the appointment, the doctor is difficult, other one is it costs a lot of money. So a pharmacist is like a barefoot doctor, available always to help the patient in their minor ailments or symptoms for the symptomatic relief. So aches, pains, sudden severe pain, fever, cold, cough, allergy, minor burns, minor cuts and wounds, nausea, vomiting, and loose motion. See, in the corona pandemic times, the pharmacists became very much scared and are not giving the fever and cold cough medicines. It happened with me. I went to a pharmacist to buy the paracetamol for to manage my fever, and he said that we are not supposed to give. Drug administration has a ban of giving even paracetamol to the public. They should not take paracetamol. I don't understand what is the logic behind it, because the patient is having a fever and he should be given more, say, already established safe drug like paracetamol. Even that was refused in many medical shops, and we found that they have been instructed by the drug controlling authority to not to give. I don't know what they achieve by begging the people to suffer from fever when they mostly need it. So this controversy has come to me, and I believe that the community pharmacists in our country are very much scared of drug administration, and they want to please them rather than their non-prescription medicines without any fear or favor. Okay, next slide, please. So next slide, please. I don't want to talk about it. This is in all there. New avenues for pharmacists to this thing. Recently, I find in some of the medical shops that we give monitoring of hypertension and diabetes, and they want to help the people. And if they start measuring the BP and BMI and also the blood glucose levels, that will help the patient uh, to visiting of a physician's room, because physicians are very less and there is a big queue in front of them, and if that help can be provided by the pharmacist in the pharmacy, it will be great service to healthcare system, and it will take away the much pressure on the healthcare system, because the pharmacists are monitoring the hypertension and diabetes in the win-win situation where pharmacists come into the patient's eye as a caregiver and gets recognized in due course. And people say this was the same practice which has made the pharmacist as an important profession in abroad. Next slide, please. So I want to share an experience in my life. My father was a pharmacist. I will be taking to 1960s when my father established a medical store in his native place, or in my native place called as Haryana, where he was a very much appreciated person, and I'm very proud of my father because he had understood his role and played a vital this thing, and some of his ways are very, very applicable even today. He used to understand the patient need, and he used to give the information to the patient which is vital. And sometimes, although he did not have an access for formal education, he would always discuss with the medical representatives and also learn so many things and advise the doctors, supplement the doctors with this knowledge of the medical representatives discussed with him. So the next aspect is the in those days my town is surrounded by many villages, and farmers are there working in the fields and used to get the snake bites. So poisonous snake bites will lead to death. In such circumstances, you need to give immediately the Hoskins Institute vaccine for antidote for the snake bite, and which was costing around 500 rupees in those times, and it is only it is only expiry date is 6 months. Within 6 months, that injection has to be consumed by someone. So, looking at the plight of the pharmacist, say, dying without anti-snake venom, my father felt it is very much uh, insulting pharmacy profession, because he has to take the responsibility. All other chemists in my town were not daring to take the risk of loss of 500 rupees due to vaccine expiration. So there was no replacement or anything, but my father always used to keep it. And I still remember night 2 o'clock, 1 o'clock, some 12 early morning, in the night, people used to knock our door, and my father used to go and give that injection to the patient, and doctor will inject that this thing and show the patient. So several people were saved, and my father and his medical shop got a new idea, recognition, and people started loving and liking him. And this is how the pharmacist can provide service to the public without this thing. And then and due to it, a lot of people visited my father's shop, and my father's shop has earned a very good will. And people used to say, this man is good. Whenever we go for any serious medicines, it will be available there. Why to go and iron? So all people used to rush, and he used to have a lot of business with this. The second, he was a successful pharmacist. He had an idea that if I lose money, if I invest money somewhere, some time, the same people in the community will help me to get out of this. So during my professorship in Manipal, I caught up with an idea that the plight of the people has not changed much. Still, they are under ignorance, and somehow we have to help. So we choose the platform of a medical shop in Manipal. It is called as Manipal Drug House. In front of the Kasturba Hospital, it is there. So Premchand Pai, who is also an ex-alumni of the Manipal College of Pharmaceutical Sciences, and I requested him to give a space in front of his shop. He readily agreed, and we, in the evening, we used to go there and started meeting people, discussing of their problem, and how do we help them. All these things we started thinking. So the concept of pharmaceutical care, I was in 2007 or 2008, led me to form an association of Community Pharmacists of India, through which we want to develop a business model to help people in the pharmacy practice. Further, what happened, we came across a variety of problems with the different people, and doctors are also not very much cooperative. They were skeptical, people were skeptical. So myself and my students used to wear apron and sit in front of the shop. And for first few weeks, nobody came to us. People saw that we are coming for business, we are selling something. And one of my brilliant students gave an idea, sir, why people are not coming, He asked me. I said, I don't know. So he made one white paper slogan, services are free. Your BP, your blood sugar, and your BMI can be monitored free. On that day, we had a very huge visitors. So that is the psychology of the people. People want everything to be free. It's all right. We wanted to provide a service. We are established an NGO whose aim is to not to make money but to help people. So that small idea by my students helped a lot. And then there was no question of dearth of people. Anytime, anywhere we go, there are a lot of people who are visiting us. Another model we practice is the home medication reviews. So patients who are at home, they have a lot of problem. They can't go to doctor, and in such circumstances, we thought that let us utilize the Sundays. Sundays 10 to 12:30 or 10 to 1 p.m. We'll go. We selected a small village in the near Manipal. That is called as Parkala. So we visited home to home and Parkala and checked, asked for the prescriptions written, and checked how the patients were using medicines. All these things were we found a lot of cases, and we resolved those cases, and we improved the quality of life of the patient. And also, in our country, the idea of nutrition is not there, and as a result of it, many college-going students suffer from backache. And what they do is they go to a medical shop and ask for a painkiller, and which is not very good in the due course, because we know that the NSAIDs painkillers are harmful to kidney. Although they give a temporary relief to the backache, actual relief is to something else, to supplement them with the proteins. So what is the easiest way we found to supplement the proteins in their diet is, we said that you take one fistful of moong, green gram, moong, and then moong sabut, soak it in water and eat it for 15 days continuously in the morning. So the backache is gone, and use it for 1 month. Your obesity is gone. Obesity, you start losing weight because it is a balanced diet. The moong, when consumed every day, it will remove the anomalies in the muscles, and muscles become stronger, and there is no question of pain, backache, muscle pain, and all these things, along with the hypertension, so many, and diabetes and overweight, all can be resolved with this moong doctor. And you know what? I earned a name. I earned a name that I'm a Moonka doctor. So people used to identify me in the community that he is a Moonka doctor, because I had to tell Moong to everyone, because everyone had a connection with the protein deficiency. So that's how I earned a nickname in Manipal as a Moonka doctor. Yes, next slide, please. I got some few slides, and then I'll stop my thing. So no need. Next. Not about law and other things. I don't want to talk. Come to next slide. Come to some photos. Go on changing the slides with text. I would like to speak about the. So this is the sacred document brought about by a FIP in connection with WHO. This is called as the Focus on Patient Care, Developing Pharmacy Practice. Next slide, please. Next slide, please. Hello. Can you change the slide? Next. I don't know what happened. I think I came back to the room. Now I'll be visible to you. Now we can continue. So I was talking about my presentation. Can you please display my presentation? Share my presentation. Organizer, is he there or not? Hello? 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 again and again it is causing a webinar. Hello, yes? Move to the slide where I left.
Yes, sir, I'm getting it there.
Hello?
Yes, sir, I'm getting it there.
Uh-huh. Next. Yeah, this is the FIP. This thing. Next slide, please. See, this is where home medication review. I was like this in 2008, and then I'm meeting a patient at his home and analyzing his prescriptions and giving him the information. Next slide, please. So what we used to do is we used to take the prescription home and work in the department and find out whether the patient is having the right dose, whether he is taking medicines appropriately, whether the medicine are been stored properly at home. So many things we used to work on. Next slide, please. So next slide, please. I don't want to go now. Only diagrams I want to. Photos. You focus on photos. Go to the next slide. So next slide, please. Few more are there. No, next slide, please. Slide is not visible. Please change the slide.
The slides got over, I think.
Bring the slide. That photographs only you exhibit, and I'll close my session and open it for questions and answers. So it is 1.5 hours, you know.
Sorry, sir.
Hmm.
So it's 1 hour.
Whatever you feel satisfied, then you can close. Otherwise, I have a lot of interest to continue.
No problem. So we get the room limit is actually 1 hour. Like we don't have any problems, but the room we conduct in, like this webinar jam room, we get 1 hour.
Whatever you say, whatever you say, you want.
Sure, sir.
This is the community work. Previous slide. Previous slide, please. So wherein we are going to the patient's home in a bus and work till morning to evening and come back to the campus. It is in Manipal. I'm very much grateful to Manipal for giving me all these opportunities. Next. 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 Yeah, this is the card we have made. Please focus that card. wherein all our students' numbers are printed in it. And anybody wanted an information, we used to give these cards to the patients. Anytime they can ask question on these numbers, we would like to answer. So this is how our innovation is. Yes, next slide. Next. Next. So this is the program we conducted in Srinivasa College of Pharmacy, Bangalore. Yes, next. Internship program for students we have designed. Several students have undergone this training and understood the community pharmacy, importance of community pharmacy. Next slide, please. Next. 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 So know your medicine, know your pharmacist. These are the slides prepared by the Indian Pharmaceutical Association on the occasion of National Pharmacy Week. Yes. Next, please. So this is the where we went to patient's home and gave them the medication therapy management. Next. So a pharmacist, a healthcare professional. Again, National Pharmacy Week celebrations brochure by IPA. Next. So focusing our attention on polypharmacy, where a lot of drugs are prescribed and patient has to take. So this is one of the tragedy. And how to take is not been asked, not been told. The patient will end up with adverse drug reactions or less effect of the drugs. Yes, next. So next, yeah, next. So a lot of good words for pharmacists. Provided we do good service, then we become eligible for these titles and this song and other things. Otherwise, waste of opportunity. Next. Next slide. Next slide. Next slide. So 10 years ago, this was our slogan by Indian Pharmaceutical Association. Next. So safety first with medicines. Of course, I have been telling pharmaceutical care everywhere, the same meaning. Next. Here are some handouts by Indian Pharmaceutical Association. Next. Yeah. Next. Show your concern. In a pharmacy, these placards are kept in order to sensitize the patient to lead a healthy lifestyle. Next. A view of a pharmacy. I think not pharmacy, it is something cigarettes and all the things. Yeah, next. Thank you. Thank you very much for a patient listening. I don't know how many people are there. So please tell me your comments, questions, criticisms. I'm very eager to get a feedback.
Definitely, sir. What we basically do is because of this, because of the time issue, what we basically do is after the webinar, we provide this email link to everyone with a dashboard mail to everyone with the feedback link as well as your mail ID as well, sir. So people who do have some personal questions as well, they can ask you certain questions on email, sir. And at the same time, they will also be giving you feedbacks on mail as well. And once we start receiving feedback links, we will also be forwarding you those mails, sir, the feedback links after the
Thank you very much.
so before ending this, sir, we just have a short information for the attendees. The people who have been attending us online will receive will be receiving an email shortly with this feedback link and the certificate download link as well. So nobody needs to panic about how they're going to get the certificates. They'll be getting it very soon from the dashboard. And thank you so much, Anand sir, for this beautiful and informative session. I think people must have learned a lot from it. We'll also be providing you a recorded version of the webinar, sir, very shortly. And we assure everyone that we will be coming up with more interesting hosting webinars with Association of Pharmaceutical Research. And definitely, sir, we'll be looking forward to host more webinars with you in the future as well. So till the next time, we urge everyone to stay safe during this pandemic time, as we all know what the world is going through. So till the next time, it's goodbye from our side. Thank you so much, sir. Thank you
Goodbye.
so much.
Thank you.
Thank you. Thank you.
Salute to you.